We are Karimu, an NGO dedicated to fighting extreme poverty in rural Tanzania. In 2025, we celebrate an unprecedented shift. In Ayalagaya, we began the gradual exit after having successfully brought 12,000 people out of poverty. In Arri, we've achieved astonishing progress, placing 16,000 people on the path out of poverty. And in Dabil, the journey just begins to free 20,000 people from poverty in the coming years. This video showcases the accomplishments of 2025, demonstrating how poverty elimination is not just a dream, but a reality for thousands who've benefited from Karimu's work. Karimu's methodology is simple. We address lack of proper sanitation, poor health, insufficient education, meager income, and lack of access to financial services. Karimu follows a three-phase process, from selection and assessment to project execution and gradual exit. Donations in 2025 amounted to a bit more than $1 million. They came from 401 donors from 27 countries. These allowed to execute 87 projects by 59 volunteers and 8 local staff members in Tanzania. Let's first talk about awards and recognitions obtained by Karimu. First of all, Candid awarded Karimu with the Platinum Seal of Transparency, which ranks the NGO in the top 0.1% of US charities. Also, Karimu was awarded the Tanzania Government Award for Compliance with the National Social Security Fund. Shao, the regional director for Karimu, was the guest of honor to the Ayalagaya secondary and high school graduation. 2 doctors and 2 nurses of the Daradakati Health Center were awarded the best medical staff in the Babati district. Let's talk about Ayalagaya and the gradual exit by Karimu, because the community perfectly maintains all projects, whether it's about maintaining water pipes, clinics, and schools. The provision of free water is managed by a water committee running independently from Karimu. All public institutions have clean water and modern bathrooms. Clinics are operating and providing training and medical services without Karimu's support. The Daradakati Health Center and the Gajal Dispensary have served over 100,000 people. More than 2,500 babies were born safely, including 360 babies born through C-sections. There were more than 20,000 visits just for family planning. And a new dental care clinic has already seen 160 patients. Schools are now running without Karimu's involvement. That includes hygiene education for 4,500 students and 163 teachers. Over 90% of the children reach high school. And we've reached parity between boys and girls. Schools now rank among the top in the state. 22% of the households are now members of a savings group. The average annualized savings per member is up 97%. Only 4.9% of households are now considered poorest among the poor, from over 60%. In 2025, Karimu completed the radiology, pharmacy, and high infection diseases buildings for the health center. People graduated from the entrepreneurship training and increased their income by 183%. 126 farmers were involved in producing biochar, and their profit increased by 70%. 12 farmers learned to raise chicken commercially, making $40 of net profit every month. Let's turn our attention to Arri and the execution of projects over there in 2025. Let's focus first on sanitation projects. And first of all, the remodeling of bathrooms at Sayo Secondary School. This affected 585 students and 33 teachers. At Arri Primary School, bathrooms and a hand washing sink were constructed, affecting 720 students. Let's talk about health in Arri. There were over 25,000 patient visits, 54 babies born safely, and 12,000 vaccinations. 750 people were tested for syphilis, 4 cases emerged. 400 pregnant women underwent HB testing. And over 6,000 women were trained on infant and newborn care. The tuberculosis project was closed as cases declined significantly. Let's talk about education in Arri. More than 4,000 students and 139 teachers were trained on hygiene, and all schools are serving daily lunches. 100% of the middle school students passed the national exam. However, only 74% of primary students did, so there's room for improvement. Let's talk about income projects in Arri. There were another 159 graduates from the entrepreneurship training, and they've increased their income by more than 100%. 352 farmers were involved in biochar production, and they've increased their profit by 84%. And finally, 60 farmers learned how to raise chickens commercially. Financial services in Arri. 2 savings groups fully graduated, and 12 are currently in training. Let's turn our attention to Dabil, where we're selecting and assessing projects. First of all, in the realm of sanitation. The assessment of water sources was completed. When it comes to health, there were 2 tuberculosis campaigns with 265 people tested and 30 cases emerged. There was training for 650 women on infant and newborn care. Doctors and nurses were trained on a number of different health aspects. And 100% of the schoolgirls eligible for vaccination were fully immunized against HPV. Education in Dabil. Some school material was donated. Income projects in Dabil. 454 farmers were trained to produce biochar. In terms of financial services, existing savings groups were identified and some assessments are in progress. Let's talk about social projects outside of these 3 wards. The dispensary for the Hidit ward was created, and this will serve over 10,000 people. Bathrooms were completed in Idakiso Kifaru. Let's talk about the volunteers for a short moment. There was an adult volunteer trip with 18 volunteers from 5 countries. They've completed 36 projects. There was also a family trip with 13 adults and 13 children from 3 different countries, and they've completed a detailed immersion of Karimu's work in Tanzania. An artistic competition was organized, and the winner was the dance group from the Sabilo Primary School in Dabil. There was also a sports competition. Maganjwa and Dabil were the winners of soccer, while the winners of netball was Bacho B from Ayalagaya. There was also a secondary school intelligence challenge. The winner was Edson Edibariki. Your donations make a massive difference. Find us at karimufoundation.org. Asante sana.